Dear Minister Hajdu, I am a palliative care physician in British Columbia and I'm an associate professor of clinical medicine with the University of British Columbia. I also work as a general practitioner in oncology, working with the BC Cancer Agency to deliver cancer care in my area. Palliative care has advanced significantly in the last decade. We now have excellent tools for dealing with complex pain, air hunger, nausea, anxiety, and other symptoms associated with terminal illness. One challenging symptom which we do not have treatment for is existential suffering or profound despair. This symptom is complex, but it impacts on all of the other symptoms such as pain, nausea, air hunger, anxiety. The cause of this despair is complex, but it is so dramatic. It is palpable to anyone entering the room with the patient. Family members agonize as well as their care providers, feeling helpless in the face of the suffering. I have had a number of patients for whom day-to-day living became intolerable. They had to turn to either deep sedation or medical assistance in dying to escape their despair. I had a recent experience with a patient who you expedited compassionate access to psilocybin treatment. The dramatic improvement she enjoyed for her last 5 days of life showed me that we now have an effective tool, when used by a trained professional, which can finally alleviate a symptom we previously could do nothing about. Most tools and medications we use in palliative care can be dangerous if used improperly, particularly opioids or benzodiazepines, which is why we receive extensive training in their use. Psilocybin, when administered by trained professionals, is not associated with dangerous side effects. Patients are carefully selected. They have several pre-treatment therapy sessions preparing them for the treatment. 2 therapists are generally present for the treatment, which is followed up by sessions of therapy afterwards. For our terminal patients, we need access to both legal psilocybin as well as trained professionals to administer the medication. I would like to advocate for the development of a legal psychedelic treatment program, which has trained palliative physicians and therapists who can safely administer and follow these patients. Training therapists and physicians requires that those therapists also experience a psilocybin treatment themselves so that they may guide the patient through this treatment. The necessity of this is clearly documented in research, as some of these psychedelic interventions can be frightening to a patient or to the therapist if they are unprepared for events that can occur during the treatment. I would ask, Minister, that you grant compassionate access to those therapists and physicians that wish to treat our terminal patients for this very, very difficult symptom. We now have a novel and essential medication at our fingertips. We just need to be able to use it. Thank you so much for your time.